So what we find with this North Carolina death certificate information is that if you were black and you were in a more segregated area, you actually lived a little bit longer than other blacks. You didn't necessarily live as long as whites because there still is a racial difference. And so we're looking at within race differences with health. But the interesting finding with that, and we're still working through what the actual mechanisms are, is that if you think about sort of germ theory of disease, the easiest way that I usually explain this is when you were in a college dorm and somebody at the very end of the hall got sick, eventually it found its way to you. But imagine what segregation does is it creates a wall or a barrier so that if the person at the end of the hall isn't close to you, you're sort of inoculated from that disease. And that's what can happen in a segregated environment. In other words, if there are pathogens or where there are specific sort of illnesses that are even could be, based on occupational segregation. So if whites have particular occupations that led them to be more susceptible to certain sorts of illnesses and they were in close contact with African Americans, everyone can get sick. But if they're in a segregated environment, that's less likely to occur. Well, the racism is really odd in rural areas in that in some work that John is doing now, we can look at sort of cities which are much better able to sort of segregate the provision of public services. But in a rural area, if you're going to purify the water, it is really cost ineffective to just purify the water for whites, so everyone gets pure water. And there are some other economic historians who found that the largest gains in African American health came about through water purification efforts because you couldn't exclude blacks from it. You can exclude blacks from, say, housing policy and some other sorts of policies, but and education, for example, or even occupations. But it's really hard to do that when you say clean up the water supply or clean up the air. And so we find that those are really large health effects there for rural residents. But in cities, we're actually finding the opposite, which is one of the reasons why having this comprehensive measure of segregation is really important, because in a city, for example, you can decide to have or do drainage in a particular part of the city, right, because you have a limited budget, and you may drain areas, for example, where whites are living as opposed to where African Americans live. And so that can actually exacerbate some of the health inequalities that are due to race.